We're live today. Kirk Cox, Humongo Speakers Conference Room. Kirk Cox is the Speaker of the House of Delegates from Colonial Heights, former high school teacher, former basketball coach, now the all-powerful Speaker of the House, where 51 is the new 67. Kirk Cox in his conference room with this is the biggest conference table I've ever seen in my life. I think they stole this from the demilitarized zone in North Korea, South Korea. You know, that big table where half of it is South Korea and half of it is North Korea. They have the little flags on it. I think they stole it from there. He's going to be joining us. We're with Michael Pope, reporter, Virginia Public Radio. And joining us now, Lauren Toomey, the Deputy State Director of Americans for Prosperity. She's here for an hour with us. This is Open Mic Friday at the General Assembly. We're going to answer this text from Louise Lucas. She's considering dropping by, but she says, is this the one and only John Fredericks? Should I respond to her?
Yeah.
Of course.
You should.
Yes. Oh, God, it's good to have friends in high places. Lauren Toomey is with us. She's the Deputy State Director for Americans for Prosperity.
Good
Lauren,
morning.
very nice to have you today. As you know, Terry Kilgore yesterday broke the Republican dam on Medicaid expansion, and they broke the dam on Medicaid expansion. And look, it's going to pass, right? I mean, I know you guys think you can stop it. No way, and I'll tell you why. It's going to get all 49 Democratic votes. Kilgore is 50. Lauren, there's no way that Terry Kilgore could have possibly done this if he didn't know that he could bring along at least one more Republican, right? He just wouldn't have done this. I mean, the guy's in leadership. He's too astute. So that gives him at least 51, right? So it passes there. Then you go to the Senate, where you've got 19 Democrats that are going to vote for it, plus Emmett Hanger, that's 20. Now you got a 20-20 tie. Emmett Hanger already told me that the other day. Then you got Justin Fairfax, breaks the tie. So that's done. And then Northam is going to sign it. So how do you stop it?
So it's very interesting. You know, Delegate Kilgore may have had his reasons for, stepping out of line on Medicaid expansion. He cites the Kentucky model as something that Virginia should, strive for when Kentucky has had devastating effects of their Medicaid expansion. I mean, irreversible damages. Once you do it, you can't go back. The budget impact, they expected it to be around $3 billion. It went to $6 billion. The maximum enrollment they expected in Kentucky was meant to be around 188,000 people. Over 400,000 people enrolled. So we can talk for days about the fiscal and the moral irresponsibility of expanding Medicaid and what it actually does.
Moral irresponsibility?
Yeah, because you're
giving health care accessibility to 400,000 working Virginians is immoral?
It's not health care accessibility. A Medicaid expansion card does not mean you have
let me just ask you something.
Healthcare.
If it's good enough for Mike Pence in Indiana, why isn't it good enough for us?
It's interesting.
If it's good enough for Matt Blevins in Kentucky, these are conservative Republican governors. I mean, I know you guys are happy with Mike Pence as vice president, right?
Yeah, the administration actually, there was a call yesterday afternoon around 5 p.m. with the president's folks at Health and Human Services. And they made it very clear to Senate leadership that the president is not going to be funding Medicaid expansion. So what they're going to do is to states that have expanded Medicaid over a 7-year period, they're going to roll back funding. So initially, right now, those states that have expanded
roll it back to what?
They're not going to fund Medicaid anymore.
Well, that's not what they rolled out when they tried to repeal and replace Obamacare. They specifically funded the Republican states that expanded Medicaid, and now all of a sudden, magically, the president's not going to fund it.
They are going.
Lauren,
they're going for
Lauren.
Full replace and repeal Obamacare. That is the direction they're going.
That didn't work. Look, if they couldn't do it in 2017, they're not going to do it in 2018. It isn't even on the agenda. Now go to 2019. They're lucky. The Republicans, even if they keep the Congress, they keep the House, it's going to be by 3 votes, maybe 4. So their majority goes down. I mean, they're going to lose 20 seats no matter what happens. So the best they can do is hang on by 5. Now, with a smaller majority, now they're going to repeal and replace it, and they couldn't do it in 2017?
if you saw in the president's federal budget, Medicaid expansion is not included. It's actually being gutted. So
the federal budget,
this isn't
president's federal
road.
budgets are a guideline, right? They hit Congress and they go in the delete bin. I mean, you can't judge us by that. No president's budget ever gets adopted ever in history.
It's not simply by the budget, which is why Senate leadership yesterday, we're working on the budget here in Virginia. That's why the call yesterday was vital to see if this money is actually going to be there. There's lots of information about their states that have expanded Medicaid. They're in a better position for now. But over a 7-year period, they're going to be rolling back their funding. And the states are going to have to come up with that money. In cases where the Medicaid expansion already has tripled in costs and takes up a huge chunk of state budgets, with the match from the federal government, it's not a good choice or investment. Or, you talk about specifically on the show all the time how Washington is not dependable. In this case specifically, that's the direction it's going in, is away from expanding Medicaid. So putting folks and taxpayers on the line for this program,
right.
I mean,
so you're going to say that the federal government, the Republican federal government, is going to pull Medicaid expansion funding, and all of the conservative Republican states like Kentucky and Indiana that went for Medicaid expansion, this administration and other Republicans in Congress are just going to throw them overboard.
They're
Never
going
happened.
They're going to be rolling back funding over a 7-year period.
Why did they do it when Paul Ryan rolled out his plan? Here's what got me to change on it. Okay, let's just put our cards on the table, Lauren, because I fought the battle to stop it with you and AFP for 3 years. I was on the forefront of that battle, and we were successful in fighting it. Here's why I flipped. Right? I went to a White House briefing with Secretary at the time, Tom Price, Sean Spicer, blah, 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 all the administration officials there. This is when they were rolling out their plan for repealing and replacing Obamacare, which I was in favor of. And in the plan that they rolled out, they had funding for those Republican states that had expanded Medicaid, like Indiana and Arkansas, and John Cage's Ohio and others, in perpetuity. Like, the funding was never cut. It was never cut ever. It was a perpetuitous funding. And then for the states that didn't expand it, like Virginia, we were getting a block grant. And when I looked at the block grant was 85% of what we were getting now. So I asked this question right there in the briefing room to Secretary Price, who was my congressman. I'm like, so Virginia fought this, did what we thought was the responsible thing, right? Responsible thing, because we thought Obamacare would eventually go away. And now what you're telling me is Virginia's going to get 15% less money than we're getting now. And what you're telling me is that those Republican states that passed Medicaid expansion, they're going to continue to get the money in perpetuity.
No, I'm not.
And that's your plan.
I'm definitely not telling you that they're going to continue.
But that's the plan they rolled out. And right there I said, I'm done. I'm done fighting something where you fight it, you win, and then you get screwed.
Yeah, absolutely. And that makes sense. What was very clear on the call yesterday was that is not the case. In 3 to 7 years, everybody who has expanded Medicaid is going to be in a very, very big problem.
Then why did Matt Blevins expand it in Kentucky?
They expanded it with work requirements as a means to get people off the rolls. As the Kentucky case study shows us, that is not what happens. So they expanded it with work requirements to encourage people to get off Medicaid. Medicaid was initially intended for people who can't work.
But Medicaid expansion is for working people like Trump voters that have 2 and 3 jobs, that have no coverage, they can't afford to buy it, but they make too much money to qualify for traditional Medicaid or any of the subsidies. So this is not welfare. This is people that are working.
But the people on Medicaid, so if we expand Medicaid, there are people who have been on Medicaid wait lists in Virginia, by the way, for 10 to 15 years. So we're going to expand it when those people they've been waiting. So what do we tell those people? We're going to expand it to another 400,000 people while you've been waiting for 10 to 15 years on the on Medicaid expansion wait list? That doesn't make any sense.
I'm not sure what that argument is. Okay, let's get to Senator Bill D. Steph. He has
Good morning, Senator.
Morning. How you doing today? What you're referring to is the folks who have been on there. Most of them over 10 years, some of them as long as 16 or 17
That's
years,
right.
is those on IDDD waivers. So they're waiting for their IDDD waivers to kick in for Medicaid.
Yes.
And if you look at the Senate, the 3 bills we passed, we have 3 things that we looked at, expanding on what Trump has helped do and offer. The first part is offering an extended care. For catastrophic. So if you need catastrophic care, there's going to be a lower price policy for you. The second thing is, I believe it's 2,400 individuals on IDDD waivers. We're expanding it for them. And every year we expand and put additional folks with IDDD on Medicaid. It happens every year. We cut it out of the budget. It's happened every year since I've been here. It's something we need to do. It's the right thing to do. And then the last thing we've done, if you looked at in the past, the temporary insurance used to be only for 90 days. Under Trump, they helped us expand it to 364 days. So what the Senate did was say, Virginia will take advantage of that 364 days. Yeah. And the other piece of this for the insurance on the short-term insurance, they call it short-term. It's a cheaper policy, but it allows us to get off of Obamacare and get on a cheaper policy that's a full coverage policy. And really, it's part of the loopholes. But it's they took out the piece that said you couldn't renew it, so it's renewable. So instead of having a 1-year policy, you'll have a 1-year minus 1 day policy, and it's going to be a cheaper policy, and it'll be back to a market-driven like we've had before.
Okay, so as far as Delegate Terry Kilgore's plan, which is to model Medicaid expansion in Virginia after Kentucky or Indiana, what is your position?
I've not read Terry's plan on this. I saw 2 press releases on it yesterday. Somebody dropped by a package of stuff last night. I've not read it yet, so I was going to read it over the weekend. But I'm not going to comment on something I haven't read. Anyways.
So, are you open to expanding Medicaid in Virginia or not?
I am not. But I am supportive of the plan the Senate put out. We put out that 3-part plan. I think it's a great plan. Savon Donovan, Bryce Reeves, Steve Newman, Emmett Hanger, those guys put a lot of time and effort into it. And I think they came up with a solution that's a viable solution for the Commonwealth. That's my personal thoughts. I can't speak for anybody else. I won't speak for anyone else. I saw that you were in here. I told you I'd swing by for a couple minutes. I got to run the tourism caucus now. Nice. But I thought we were going to talk about something else, but whatever.
Yeah, let's
whatever it is.
Let's talk about the tourism caucus and offshore drilling off of Virginia Beach. How do you stand on that and why?
Well, first of all, tourism caucus. So they've asked me to take over as chair of that. I already chair the Hampton Roads caucus. My first meeting was last week. I think we had 6 people in it, not many. Really, on the tourism caucus, everything west of Richmond, where we have the beautiful scenery, beautiful sites, we really need to push that. The Spearhead Trails, Williamsburg, and then Virginia Beach, and anything that touches Virginia Beach and the Eastern Shore, Nassau, Wallops Island. Think about the things that we have to offer. That's what we really need to expand. So what we're going to talk about today is a couple of little things, and then I'm going to talk to everybody about, hey, here's how we need to really lay out the roadmap for the future on this tourism caucus and get things moving forward. Back to your other piece, which was
offshore drilling.
Offshore drilling. When I was on Virginia Beach City Council, I took the position that we shouldn't do anything that would impact or negatively impact the Navy. If you look at where they are, any type of offshore drilling for oil would be a bad thing, in my opinion. It would be very difficult to do that without getting in the Navy's way. If you look at the Navy operational area out there, you've got a small couple of windows. I don't think it would be worth the risk. And then if you look at tourism, line of sight, 14 miles, maybe 20 miles, depending on the height of the oil rig, I don't think it's a wise decision to put them in. And if you're looking at putting the windmills in or anything like that, I don't think it's a wise decision to put it in within 20 miles. I think if you're going to do something like that, you've got to put it way, way, way out there, so you're not compromising the visual appeal of Virginia Beach or from Virginia Beach out to the ocean.
Okay, so you're basically taking the Scott Taylor position that you're generally in favor of drilling, but you feel drilling off the shore, maybe 20 miles, 30 miles, depending on the height of the oil rig. I don't think it's a wise decision to put it in within 20 miles. I think if you're going to do something like that, you've got to put it way, way, way out there, so you're not compromising the visual appeal of Virginia Beach or from Virginia Beach out to the ocean. Okay, so you're basically taking the Scott Taylor position that you're generally in favor of of the Eastern Shore of Virginia Beach is not the right thing to do. Is that? I'm just trying to figure out.
Pretty much. I do not know Scott Taylor's position on this.
The
so
same.
I'm just telling you the position I've kept since I was on City Council 12 years ago.
Right.
So I've pretty much had the same position. If you're going to do it, you got to do it way, way, way out where it won't impact the beach ever, where there won't be any issues. And I don't think oil is the right thing to drill for today. If you look at where we are, I mean, look at the price of natural gas. Natural gas is the future, cleaner burning, better decision on everything. Even if you're going to do windmills out there, you got to put them way, way, way out there, more than 25, 30 miles out. You don't want to mess up the visual appeal. That's kind of my position.
All right, Senator Bill D. Steph, I know you have to take off.
Have a good one.
We appreciate you coming by here, Republican Virginia Beach. Thank you, Bill. Always a pleasure to have you with us. So with us is Lauren Toomey, Deputy State Director for Americans for Prosperity, Ben Knotts, Grassroots Director, Americans for Prosperity, Michael Pope, Virginia Public Radio, and House of Delegates member from Roanoke, Democrat Sam Rasool is with us. Sam, good to have you, man.
Good morning. Good to be with you.
We're going to be talking about Medicaid expansion and many other things coming up with our roundtable. Now, Sam Rasool, we're talking about Medicaid expansion. I want to get to one question that we had here, which was on, Lauren, remind me very quickly.
The IDD waivers, I think the question was, that's what drives up the cost of Medicaid. And, great question, great point. I think there's a laundry list of things that drive up the cost of Medicaid if we actually look into it. But when you're expanding Medicaid to able-bodied individuals, that certainly drives up the cost, and it removes access from people who are truly meant to be on Medicaid. So for instance, I can wait a month for a checkup or for a doctor's appointment. My grandmother, my grandparents, they cannot wait a month. But if we're all on Medicaid and under the same circumstances, that's where the problem lies. So I think the question on waivers and expanding to able-bodied individuals, that absolutely drives up cost, and it cuts access to the people that the program was originally meant for, and the intent of the program. This wasn't supposed to be something permanent. Medicaid was not supposed to be your means of health insurance from when you're age 26 to 75. So when it starts moving in that direction with waivers, with having able-bodied folks on this program, the people who really need it, the needy, the disabled, the elderly, like I talked about, my grandparents, those are the people who get their access cut. And like I said, there's a laundry list of things that drive up costs.
I'm going to go to Delegate Rasool here in a minute, but to be clear, what you're saying is that low-income disabled people who cost the most to care, you're saying that they deserve government help, but not low-income working people who are Trump voters who need a hand as Delegate
poor Trump people. Good grief. That's just crazy. That we're going to blame the Trump voter. That they need
not blaming the Trump voter.
Do a welfare program.
This is not a welfare program. These people are working.
Trump to get them jobs so they can have insurance. Not so they can be thrown into another government program. My family's a Trump voter. They don't want to be on Medicaid.
Yeah.
You know what they want? They want a better economy.
Well, then you don't have to be on Medicaid.
West Virginia,
it's not like they're forcing you on this program.
Look at West Virginia. It has got the highest Trump approval ratings in America. And most of these guys, they don't want more handout. They want their economy working. They focus on the economy that gives them insurance. That's what people want. And I don't buy this argument that the poor Trump voter needs a Medicaid program because they want insurance through their work, and they want an economy that provides it, and that's the solution.
Right, and as soon as they get there, then they'll go off the program. So all this is just a helping hand from point A to point B.
Because what you have to understand is when you create this market spot for people to do it, they kick people off their insurance plans because they say, well, you're too expensive to cover anyway.
So you think that people will continue to work for minimum wage in order to get Medicaid expansion? That's like a ridiculous argument.
I disagree with that, because nobody should be.
Well, that's what you just said.
No, but you're saying that they had these people that are on this gap. What's going to happen is this: Kentucky and Arkansas proved it. Right. When they created this market for these people, they kicked them off their insurance plans because you can go. It's cheaper for the government to pay for you than us.
Right.
And that's a fact. I mean,
Medicaid?
Well, if they had insurance plans, they wouldn't need Medicaid expansion.
I want to get Delegate Rasool.
Let's get Rasool because this is a lot of gibberish.
Yeah. So I mean, I really try to be as objective and as fair as I can in a lot of these conversations.
Then why are you in politics?
By the way, that, believe it or not, John, I think that's what got a child of immigrants elected in Southwest Virginia, is trying to be real with folks as much as we can. You know, John, that's the way we try to operate. By the way, it's always sunny in Roanoke, so we always love to have you all there for sure.
I know I need to come back one of these days.
So you know, the variety of conversations happening. The point of waivers, many times. Okay, waivers are people who qualify for Medicaid in many respects, but want to take certain support in a different way. So many times we'll have like community waivers where this person could actually be in a nursing home, but we pay less for them to stay in the community, and we give them this waiver so that way they have this community support waiver in lots of different ways. Now, we're bringing up several points. The point that Ben, I don't really know if he was clarifying here, but you know, there's a big donut hole here. People make too little to qualify for the federal subsidies. So you're not kicking them off of insurance rolls because they didn't make enough money to be able to afford either the government subsidies or private insurance to begin with. And what happened is we literally had two sisters working in a diner. And they both one of them had 2 children, one of them had 3 children. And they're making the same amount of money, but because one of them had 3 children and one of them had 2 children, one of them qualified under the healthcare.gov and one of them did not. And it doesn't make any sense that they could not, the other one could not actually get some support. The reality is we pay for it anyway. We can debate it all day, but we pay for this either in higher insurance premiums, higher taxes, because some of this is right through the state budget. And so we just need to be real with folks. And for me, you know, I'm just not a big fan of sitting here saying, oh, people don't want help. They do want help. And I'll tell you, Roanoke is the second highest per capita locality that needs this help, because we see a lot of people who cannot afford the skyrocketing cost of health insurance.
The problem with that argument you just made is very simple. Nobody's arguing that people need help when they don't get insurance. Nobody's arguing about that. So we all agree. You agree?
Yes,
all right.
absolutely.
So we agree with this. And what the difference is what is the best means to get them help?
Right.
Is it a program that we are not controlling health care costs? So you can keep throwing money at Medicaid to pay for health care bills. We're doing absolutely nothing to drive down the cost. Now, President Trump and the administration, and they're working in Congress to try and drive down the cost. We're working in Virginia to have more. The thing we need to expand truly is health care options. We need more doctors. We need more nurses, because then these guys can offer different prices
Access
to
to
people there.
care, yeah.
So this is what we have to understand, is that everybody agrees with the fact that people need help, but it's the best means. And in Kentucky, we saw that this was not the best means. Even with work requirements all the way, it was still too expensive.
People love their version of Medicaid expansion in Kentucky, number one. Number two, Ben, I completely...
Except the Secretary of Health. The Secretary of Health there she said very clearly that that they could not contain it even with these work requirements.
I completely, I think contain you mean by costs.
Right.
I completely agree with you that most of these programs are talking about access and are not addressing the critical problem of costs. We are all I think we can all be on the same page. Health insurance costs, but health care costs. We do not have good initiatives in place to really try to control costs, and that's a really important conversation. And I think it's important to separate that out. That, you know, we need to be doing a lot more. There isn't anything coming out of the Trump administration, out of Congress, that is really trying to reel in costs. Because by the way, it is difficult. So I'm not blaming any of them, because we haven't been able to figure this out in a long time. But let's be clear. There's an access problem and there's a cost problem, and we should separate those out.
Yeah, kind of speaking to Kentucky hospitals said Medicaid is forcing them to make cuts and layoffs. They actually lose more money under Medicaid expansion than they gain. And
they closed hospitals. Yeah,
they closed hospitals. And so that's kind of an argument where the cost and access come together, right? The costs don't line up. So then these hospitals have to make layoffs to nurses. Some of them have to close. And then that necessarily feeds into access to care, because people don't have their local hospitals. So then, your local hospital might have been, in Kentucky a half hour away. Now it's an hour away.
And Medicaid expansion almost cost, I think, was it Bill Stanley, a hospital in Virginia too?
Yeah.
They were closing them over that. I don't know if y'all read that.
Well, we don't have
report,
Medicaid expansion in Virginia.
Well, they were
so
arguing over Medicaid expansion, though.
I just want to make sure. Look, I love having these debates. Let's just be clear about information. We don't have Medicaid expansion.
What I was saying is that they were using Medicaid expansion as leverage to keep a hospital open. Yeah. And when you're making those kind of decisions, so technically we almost lost a hospital because of people being strong-armed over Medicaid expansion in Virginia. And that's not the kind of stuff that people are really interested in. That kind of dirty politics is not right for Virginia, but that's how they're playing to expand it. I just think that's inappropriate. I'd say you agree with that.
You know what? I agree with you. We should look at all these different situations where the hospitals, many of them are under stress.
Yeah.
Some of them do need to be managed better.
Sure.
That they are under fiscal stress because their Medicare payments are decreasing. Mm-hmm. Because when we passed the ACA, we said we're going to cut your Medicare, but you're going to get more in Medicaid. And unfortunately, of course, we did not expand Medicaid. So they've, a lot of these larger health systems are just fine.
But in states that expanded, though, they still had hospitals close. I mean, that's a fact. Yeah, Arkansas, the same thing. Iowa, the same thing.
I tried to be fair to you.
Yeah.
And I tried to say some hospitals are not managed very well.
Sure.
And so maybe that plays into some of the problems that they have. So let's make sure we do that the other way, right?
Yeah.
So there are lots of reasons why if a hospital closed in Kentucky, to point a finger one way, it clearly doesn't make sense that they're getting more money.
But the Secretary of Health said that's why they closed, was that they expanded Medicaid. I can send you the quote.
Sure. And there are lots of quotes we can go around. But what we really want, why I like being on John's show, is we try to cut through a lot of the BS.
Yeah.
And let's just be real with each other. Look, there are a lot of people that need some help, and we need to do that in the most fiscally responsible way. Sure. And ignoring it and saying people don't want health care or don't need it and they don't want support, that is just, they can't keep up with this system that's continuously working against them. So let's just try to find, let's cut through kind of the partisan rhetoric sometimes and try to figure out what's the best thing for the Commonwealth moving forward.
Here's a fact: 83 hospitals have closed since 2010, before Obamacare, and your Kentucky example, I think, Ben, is twisted, because that hospital in Kentucky hospitals were getting hammered because of uncompensated care. That's why the governor went to the Medicaid expansion model, so that the hospitals can at least get 73 cents on the dollar instead of 0 cents on the dollar through indigent care. Because right now, these people that are not covered, here's what they do. Somebody gets sick, somebody breaks an arm, a leg, a foot, whatever, they have a problem, they go to the emergency room. Those hospitals take them, they care for them, they have no insurance, they can't pay, right? Yep. So that's just, they get 0. Yep. So you get Medicaid expansion and they're getting 73 cents on the dollar instead of 0 cents on the dollar. So the argument that Medicaid expansion caused a hospital shutdown is ridiculous, because their biggest problem is uncompensated care. And that's what this is trying to get at. And if you look at either the Kentucky model or the Indiana model, it's not welfare. There's a copay that goes with it. You have to pay something. You have to pay a little bit for the insurance.
But that's the proposal. That's the proposal, and that we don't know what's going to be passed yet.
But that's,
even with all
that's
those
where
things,
the negotiation of Kurt Cox and the governor come in. And look, I've moved past this because, do you believe in math?
No.
Okay.
No,
you don't believe in math, right?
I'm in politics, John.
Do you believe in history? If you believe in history or math, right? Mm-hmm. This is going to pass. Right? The Republicans, with Terry Kilgore and another Republican that he knows he has, it is going to pass the House of Representatives, the House of Delegates. It is going to pass the Senate with Emmett Hanger and a tie. And so now the debate is not whether or not it's good, bad, ugly. Now the debate is what you're going to negotiate with the governor, and that's where Speaker Cox comes in.
But the assumption is that we have to start in a position of weakness, and I'm just again, we agree. We need to help people. We need to help people.
It is going to pass.
But I will tell you. Now listen. Now they said that when if they had this mindset, when you said earlier that people were saying that there was a majority it would never pass, and now you have Kilgore. If anybody can change. Until it's law, it's not law, and we're not going to stop until Now, let me just make a clear thing. If you go to the Louisville Courier-Journal, you can read plain as day. They say, quote, Kentucky hospitals will lose more money, and this is from the Hospital Association. So these people, these are people that have an invested interest. We lose more money under the Affordable Care Act than we gain in revenue from expanded coverage. And this is after they expanded. They said it is not resolving the problem.
That is probably true, Ben, exactly what you said, because you said the words Affordable Care Act. And in the Affordable Care Act, there are a number of moving parts. They lost a lot of money because in the Affordable Care Act, they put pressure on hospitals and decreased their Medicare compensation. And we're going to partially make up for that with increasing Medicaid and trying to tell hospitals you need to be more efficient. So what you read is probably 100% true, that they probably did see an overall decrease. The whole point was it wasn't going to level out. It was going to say we're going to decrease your Medicare, but we're going to increase the Medicaid, and we're going to tell you you need to be more efficient. And the efficiencies, I don't want to get too wonky on you, but there are some ways where, of course, hospitals can be more efficient.
And there, specifically in regards to actually. Okay.
Well, I was just going to go back to John's point about math, right?
Yeah.
So we're on the verge of having the money committees.
Michael Pope.
We're on the verge of having the money committees, release their documents, and there's revenue. There's revenue Virginia gets from expanding Medicaid. It's like $400 million. And so if you don't, if you have the position that you're not going to expand Medicaid, you're going to need to find $100 million for the teacher raises. You're going to need to find like $300 million to pump back in the rainy day fund so Wall Street continues to give Virginia AAA credit rating. And so, that's kind of where we're at right now. If you don't expand Medicaid, you're going to need to find like $400 million.
I want to take the money.
Well, here's the thing.
I just want to take the money.
It's not going to be there
because but it's there right now. And
why couldn't you take the money from Barack Obama, but you can take it from Donald Trump?
Because
that's just ridiculous.
I tell you what,
it wasn't good enough.
I love Trump's money.
If it's good enough for Mike Pence in Indiana, it's damn well good enough for me in Virginia. And I'll tell you something else, Ben.
Our state director, they have problems in Indiana.
Either the money is going to come to Virginia or it's going to go to Jerry Brown in California. The money is going. This idea that somehow Virginia is going to stop this trend and, we're going to be the only state that stands out and we're the austerity state.
That's not the point. That's not the point.
The point is the money is going to Jerry Brown instead of Virginia. Tell me that makes sense.
HHS said they are rolling back funding over the next 7 years of states that have expanded Medicaid. So those states, the people in those states are going to be on the hook.
HHS?
Yes, there was a call yesterday afternoon.
Okay, Obamacare repeal and replace got smashed in 2017. Go to 2019. If the Republicans hang on, which I think they are,
but that's my point. You just made the point.
They're not going to repeal it.
You just made the exact point.
Obamacare is here for life. I deal in reality, not in white paper ideological dogma, which is what you're bringing.
You just asked if I believed in math. So
let me tell you.
There's no math here.
Hey, John,
the math is I want the money.
John, Lauren's point is exactly true, because that was the deal from the beginning. Is at the beginning the federal government was going to cover 100% of the costs, and the deal is that now they'll eventually be covering 90% of the cost. That's a really good deal because we're already paying more than that 10% we'd be on the hook for.
Plus the Virginia.
So you're right. The federal government,
the VHHA, the hospitals, right? McCullough's budget said they'll pick up the gap. So there is no cost.
That's right. We can definitely do this in a way that is, from a state perspective, budget neutral, but at the same time, all the hospitals and providers, we're going to be injecting billions of dollars, and this is like a $6 billion economic impact when you multiply this thing out. So, in my opinion, the single biggest thing that we can do to benefit the Virginia economy is to expand Medicaid.
So what happens, I have a question here. So, they started at 100, right? And now it's back to 90. And
it will be back to 90.
It will be back to 90. So what happens as we keep going in this trend? Say, 5 years down the road, now it's 50-50. At 10%, it already takes up a huge chunk of the state budget. So just say what I'm saying is wrong, that, Trump administration wants to keep funding Medicaid expansion. We'll say that's wrong. if they simply just keep on the trend of scaling back, isn't it inevitable that at one point states are going to be in dire straits with the fact that they cannot afford this program?
I love having a reasonable and wonderful conversation with Americans for Prosperity right
Good,
now.
same. We do as well.
It is. Thank you so much for that. That's a beautiful question, because it's in federal law that the federal government will not go below 90%. And so we've already made this deal that we're going to scale back. So we're not going to go below 90%. And if we ever went below 90%, we can just stop. But this is the law.
But you can't just stop.
But the point is
the law
this,
of the
though,
land.
but you're suggesting that the law cannot change.
Right.
I mean, now that Donald Trump's in it, they're actually talking about the HHS not even in the budget. Okay, well, let's say 10 years from now, you don't know who's going to be president. You don't know who's going to be in Congress. Imagine if you have a full Congress full of Ted Cruz-like folks.
Yeah,
Or,
well,
I mean, you want to put, but just imagine if you did. What happens to your health care? Do you want your health care to be in charge of people like that?
Is the U.S. economy going to collapse before or after the rapture? I hope it's after, because I'm going to be well the hell out of here. I'm going for the rapture first before we cut below 90%. We're out of time for this segment. John Fredericks Radio Network. Jeremy Pike just popped in, Senator. He'll be with us the next segment. Kirk Cox coming in, so a lot more to talk about right here where America comes to talk on the John Fredericks Radio Network. Stay with us.